I think the public health message for prostate cancer really is, number one, in the screening arena, people need to realize that screening exists, but it's not fully proven. There are some harms associated with screening. There's some potential benefits. And that really needs to be a public health message. The next public health message is many men who are diagnosed with prostate cancer truly do benefit from observation or watchful waiting and not rushing into treatment. And many of those men will never need to get treatment. I think that would actually help us a great deal in terms of the depression and mental anguish that many people have when diagnosed with prostate cancer. I think the most important thing that in terms of information that can be conveyed is the one clinical trial that we have that suggests that prostate cancer screening and treatment is beneficial. The one clinical trial suggests that well over 90% of the people who got treated did not need to be treated. They didn't benefit from it. Some of them didn't benefit from it because they went on and died of prostate cancer anyway. But the majority of them didn't benefit because if never diagnosed and never treated, they would have never been bothered by prostate cancer. Prostate cancer is a serious disease. I don't want to minimize that at all. It's also a very complex disease. And unfortunately, very frequently, we in medicine have come up with very simple messages when, unfortunately, the truth is very complex. So I would hope people would be a little patient with us as we try to discuss the complexities of prostate cancer, the true complexities of prostate cancer. I will also share that I say that I share the frustration that we don't have all the answers. But unfortunately, when we in medicine don't have all the answers, we need to admit that. I'm really hopeful that we're going to, through genomic medicine, through looking at what genes are turned on, what genes are turned off, and how those genes interact, I'm really hoping that we're going to be able to figure out the prostate cancers that kill and need to be treated versus the prostate cancers that will not kill and need to be watched. And I'm hopeful that in the next 10 years or so, we're going to be able to say, Mr. Jones, you have prostate cancer, and it's a serious kind, and you truly need treatment. Mr. Smith, you have prostate cancer, but it's the kind that we should watch because it's probably never going to bother you. I'm really hopeful we're going to get to that. I'm hopeful we might even be able to get to a screening test that's going to be able to say, this man is at high risk for the serious type of prostate cancer, and we need to do further workup, versus this man is not at high risk for the serious type of prostate cancer.